Dear colleagues, this is Matteo Lambertini from the University of Genova, San Martino Hospital in Genova, Italy. It's a pleasure to discuss the results of our study presented at the ASCO 2024 conference. Here we report the results of our BRCA-BCY collaboration, which is a large international multi-center hospital-based retrospective cohort study that included patients diagnosed with early-stage breast cancer, stage 1 to 3, between January 2000 and December 2020. All the patients were young at the time of diagnosis, so 40 years or less, and all of them were known to carry germline pathogenic or likely pathogenic variants in the BRCA genes. In this specific analysis, we included 4,752 patients, and we had two main objectives. The first one comparing between BRCA1 and BRCA2 carriers, and the second one to compare between patients that receive a BRCA testing before breast cancer diagnosis or at the time of breast cancer diagnosis. For the first comparison, we observed that BRCA1 and BRCA2 carriers are actually two different patient populations. They have a different patient tumor treatment characteristics and risk of survival events over time, with a higher risk of distant recurrences for BRCA2 carriers and a higher risk of second primary breast and non-breast malignancies for BRCA1 carriers, with different patterns of event over time that translate into the need of developing different prevention, treatment and follow-ups and survivorship strategies in these patients. On the other side, we investigated the impact of pre-diagnostic awareness of BRCA status, and we observed that patients that were tested before diagnosis, so they likely receive a preventive measure, an imaging screening procedure before diagnosis. They were diagnosed with a much lower stage, so more frequent small tumor and non-negative disease, and this translates into lower treatment burden with less chemotherapy use, less axillary surgery, and overall they had improved overall survival, meaning that we need to have efforts to increase awareness on BRCA status.